Welcome back to Daytime, and we're taking on some hot medical topics now that may affect you with our esteemed doctor panel here. Cardiologist Dr. Srinivas Lyengar, OBGYN Dr. Jill Hechtman, and plastic surgeon Dr. Adam Scheiner. Nice to see you all. Thank you for doing this with us. And we're going to kick things off with an always controversial topic of vaccines. All right, there are some major changes in recommendations just out from the Centers for Disease Control and Prevention, including the elimination of the nasal flu vaccine. Also, people with egg allergies can receive any age-appropriate flu vaccine instead of the egg-free vaccine. And now the HPV vaccine in adolescents will be administered in 2 doses instead of the 3 that were previously recommended. These are just some of the changes. So, doctors, how are these changes going to affect all of us, respectively?
Well, I think this is a big positive in the fact that more people are going to be able to get these vaccinations. I mean, this is a great thing when you say that more people with egg allergies now can get the regular vaccine, so there's more accessibility. And also the fact that the nasal vaccine really didn't work well. So we're going to...
Why is that?
Well, it's just the absorption component of it and the fact that the actual component of the vaccine didn't do what it should be doing, you know, inhibiting the flu or inhibiting this virus, you know.
Right, the body has to react to whatever sort of insult it has, so there wasn't enough in that vaccine that through the nasal spray to work. I think we lose 20, 30,000 people a year through the flu, and we'll say it, the vaccines are a great thing. These flu vaccines are so important. Now it opens up to a wider audience.
Definitely.
And remember, the people who are really getting that nasal vaccine were the children. And so the difference is now they're going to still get the vaccine, they're just going to get the shot.
What do we think of the human papillomavirus that's been...
I love this. Okay, so right now, to be honest, the compliance level of people getting the HPV virus vaccine is very low. So what the CDC did is they looked at data and said, you know what, we probably don't need the actual 3 doses. And if you're under the age of 15, it has been proven that only 2 doses are just as effective. So they need to be done 6 months apart from each other, and that would hopefully increase compliance.
Why are people so, parents especially, so reticent about giving their adolescents the HPV virus
I really am
vaccine?
not sure about that, because to me, it is one of the most important vaccines that you can get. It not only prevents different types of cancers, it also prevents genital warts. So there's a new vaccine that's out there that has 9 strains of the virus that helps. And I recommend it to everyone.
And I just want to bring up too that this is not just for females.
Right.
This is for males as well.
And a lot of people don't realize
They
that.
don't realize. They think it's cervical cancer only.
All right, we're going to stick with this topic of the human papillomavirus. It helps prevent cervical cancer. It does so many good things. Recently, Erin Andrews, who most of you know from Fox Sports and Dancing with the Stars, revealed that she was diagnosed with cervical cancer and underwent surgery to successfully remove all traces of the disease. Now, according to the National Cervical Cancer Coalition, nearly 13,000 women in the U.S. are diagnosed with the disease each year. And Dr. Jill, let's go to you. What should we know about this cancer? It affects so many.
For one, it's preventable. It's preventable because if you get the vaccine, they have the most common strains that actually cause the cancer. So vaccinate, vaccinate, vaccinate. Now, I will say that there are other strains. There are about 150 different strains of the HPV virus. So if you happen to get a virulent strain that's not in that vaccine, you still are at risk. But with getting annual exams, seeing your doctor, getting your pap smear, you can prevent this cancer because you're going to catch it early. It's a slow cancer. So some cancers, you get it and it progresses really rapidly. This kind of cancer, you get something, an abnormal pap smear, you usually can get treatment before it progresses to cancer. So it's preventable.
All right, let's move on. A new study suggests that cancer doctors on social media are often paid by drug companies. In the study, researchers identified 634 oncologists who were active on Twitter and looked up whether they received personal payments from drug companies unrelated to research or grants in 2014. Now, most of them did. 72% received payments from drug companies. 44% were paid more than $1,000. Payments received by the doctors in the study ranged from $100 to more than $50,000 in a single year. So here's the question. Do patients have the right to know if their doctor is getting paid to recommend certain drugs?
Yeah, I would say absolutely. You know, we as doctors will speak at meetings, and before we give our talks, we have to have a slide talking about what companies support us. It's about disclosure. And it happens in journals and in meetings. And I think this is just the new frontier, social media, that we definitely should be doing this. I think it's fine to recommend a medication, but the patient who's getting our advice has to know that if we're getting back to give that recommendation.
It's fine to recommend a medication, but if if there's bribery involved, for lack of a better way of putting it, is that fair?
Well, Jerry, in 140 characters that Twitter has, it's very difficult to put a disclosure in there. So it is misleading entirely when someone is tweeting out, hey, we have this great new drug available that might cure your cancer. And the patient's looking at this saying, I trust my doctor, so I will see this person and hopefully go down this drug, not knowing that there was some payment involved. It is very important that this type of situation is more or less brought back into ethical realms and said, patients should definitely understand that if a doctor is hawking a medication or a trial, that there is some financial background to it.
Because it does come down to ethics, doesn't it?
It does, absolutely.
Yes. Yeah.
And remember, Jerry, it's good to have doctors on social media, because just look at us, for example, coming in here and talking about the different things. I'd rather them listen to this than go on to Dr. Google and get misinformation.
There you go. All right, coming up, if you're watching your blood pressure, you may have more breathing room than you thought. We'll tell you all about that when we come right back with our doctor panel. Stay with us. And we are back with our doctors answering lots of important questions here. And get this, 2 of the nation's leading medical groups issued guidelines on Monday recommending that people 60 and older get their systolic blood pressure below 150. Now, the target used to be 140 or lower. So these guidelines are very controversial in the medical community, especially with cardiologists. So, cardiologist, Dr. Iyengar, what do you think of this?
Well, let me tell you something, Jerry. This is such a hot button issue in medicine.
Why is that?
Because blood pressure is one of those unsexy diseases. People don't realize they have high blood pressure, don't complain about it until something happens. And so a lot of patients do not want to be on medications. I cannot tell you how many patients will come to see me in the office and say, I don't care. I feel great. Why are you going to put me on this pill? I don't want to pay for this. I don't want to have insurance cover this, whatever. The problem is blood pressure elevation, hypertension, causes a lot of problems down the road. So the issues are cardiology wants the blood pressure to lower because we've seen kidney dysfunction, heart strokes, all of these things can happen. A lot of the other physicians who don't treat cardiovascular disease or treat systemic issues like family practice physicians or internal medicine doctors will say, I have an 80-year-old patient who's taking 5 different medications and passes out every time he stands up. This is not appropriate. Let's let the blood pressure float a little bit because the side effects of the medications can cause a lot of problems. So hence you have 2 different organizations right now stating 2 kind of different things.
Sure.
Cardiologists saying 140 over 90 till you're 80, and then basically you can let it float. Whereas the other types of organizations are saying 150 over 90 over the age of 60.
Is there that big of a difference between the 2?
Definitely, because we know from all the studies that have been done over the last 70 years in medicine to show that blood pressure elevation corresponds with cardiovascular outcomes. So the fact is, too, is how many patients come in and say, the guidelines say 150, I'm 156. Come on, doc, give me 6 points.
Right.
That's the problem, is that we're dealing with a slippery slope situation. And don't forget 20 years ago, 120 over 80. Remember that?
Oh, sure.
We were talking about that, and I still believe in bringing it down because what I'm trying to tell patients, I want to avoid the eventual problem. I understand that there's acute problems with the medication. So I agree with my colleagues saying, if they're passing out and getting dizzy, we need to back off.
Okay. Bottom line, blood pressure checked. How often?
I would say if you have a history of high blood pressure, every day you should be checking it at home.
All right. Moving on, a new bill proposed by State Senator Jeff Brandes would allow Floridians to donate their medical records to science. Have you heard about this?
Yes.
Okay, the bill proposes the Agency for Healthcare Administration and the Department of Highway Safety and Motor Vehicles develop and implement an opt-in donor program for medical records upon death, much like the state's organ donation program. All right, I'm a little perplexed by this. I don't understand how my medical records would help medical science.
You know,
am I wrong here in thinking this?
There's a field of epidemiology where they look at trends in diseases, and there's a lot of things they can get out of these epidemiologic studies. So I think this is a great thing, the idea that we could get more data for them to analyze that might help society. I think one of the problems that we're looking at is that it has to be protected, because if it could look at this data and say, well, okay, that person died from this genetic disease, let's charge their relatives more money for their insurance care. That could be a slippery slope.
So there could be some sort of invasion of privacy here that would have to be dealt with. But you think the actual records would be helpful?
Yes, because anytime you can gain extra information, it's going to be better. And if we can learn something because someone donated their records, I think that's a win.
I think that legally, too, it's important that we know that it's not just the patient, but their family, like Adam just mentioned. It's really important that we know that once we get records of a certain individual, that there isn't legal recourse against the family's siblings or relatives, and there's issues that, HIPAA violations that we have to be taken into account.
A lot of obstacles to go over before this actually happens. All right, according to a study, women's brains start to show signs of decline well before they become senior citizens. Researchers analyzed data on memory and processing speed tests on more than 2,000 middle-aged women, finding that their episodic memory relating to past events declined about 2% over the course of 10 years. Now, should women worry, and what can they do about this, if anything? It sounds like not a lot, 2% over 10 years.
Feeling a little self-conscious right now.
Dr. Jill?
No, I mean, I don't take a lot of credibility in this study. I think that, when you look at factors such as lifestyle, lack of sleep, children, work, stress, I think that probably has more of a bearing than actually we're losing our cognitive function.
When I was reviewing this, my wife said, clearly this was written by men. So the fact is, I don't think any woman should be worried reading about this or hearing about this. Again, this is part of the natural cognitive issues that happen with all humans, not just women.
But if your memory starts lapsing to a great deal, you really need to talk to your family and get some help.
Sure.
Okay. Yes. Doctors, thank you so much. This has been fun. Let's do this again.
Very good. Thank you so much.
All right. And Daytime will be right back right after this. Stay with us.